Hi, my name is Casey and I'm a registered dietitian with URS Medical, and today I'll be explaining how to use ENFIT connectors in order to feed your child. Why ENFIT connectors? ENFIT was brought about because of past incidents of missed connections using feeding tube devices. Using ENFIT will prevent accidental connections to other types of tubing and prevent patient harm. Some examples that have happened in the past is feeding tube connecting to IV lines, ventilators, catheters, and other types of tubing not meant for feeding. With ENFIT, enteral feeding devices can only connect to other enteral feeding devices. There will be a male and female connector. The ENFIT connectors will be on your feeding set, your extension sets, and your syringes. The current feeding set or feeding bag already has an ENFIT tip, but it has a transitional stepped connector to be used if your extension sets or feeding tubes are not ENFIT. Currently, there are many types of syringes that can be used for feeding and giving medications to the feeding tube. These types of syringes include catheter tip, lure lock, lure slip, and oral syringes. With ENFIT, there will only be ENFIT syringes available. ENFIT connections will be on the end of extension sets for syringe feeding, or feeding through your feeding set. In conclusion, that's how you use ENFIT connectors. For more questions about ENFIT connectors or your supplies, please reach out to URS Medical or your local representative for more help. Thank you for your time.